traffic laws. Know the rules, follow the rules. Ain't the rules to protect you. Know the rules, follow the rules. The rules to protect you. You better make you late, than make you late. Life no get back to. If you drink, don't drive. If you must drive, don't drink. Save your life, take 'em easy. Obey traffic laws.
You're listening to Lagos Traffic Radio, 96.1 FM.
Money this year. We making money this year, no matter what them do.
nooks and crannies of Lagos and beyond with ease? You're right on time with us. Lagos Traffic Radio 96.1 FM, your driving companion. Healthcare is an indispensable pillar of the society, and this is due to the fact that healthy populations live longer and are more productive. The healthcare demands of a society keeps changing with time, and government have the responsibility of putting measures in place to cater for the changing needs of their people. This only means that the dialogue on affordable and efficient healthcare is one that must be sustainable and continuous. And that is why the Lagos State Health Management Agency, LASHMA, is expanding the dialogue on affordable and qualitative healthcare services to Lagosians through its program tagged ILERA EKO Extra. Tune in to ILERA EKO Extra, achieving a universal health coverage for Lagosians. ILERA EKO Extra, leaving no one behind.
Wizard boy, shall I show it on this? Eko wekele, wekele.
ILERA EKO, la wanle. ILERA EKO, lo jewan logun. Let us work hand in hand. Lagos health is our wealth.
Àwa ṣàlà lè kó wa, àwa là lè mí wa, kábígbà sọ fún Táíbà. Èkó ní ìdájọ́ o. Ìlera tó tó, ìwòsàn tó dára, àlàáfíà tó yege, Èkó ní ìbàjẹ́ o. Ìlera tó tó, ìwòsàn tó dára, àlàáfíà tó yege, Èkó ní ìbàjẹ́ o.
ILERA EKO, ILERA EKO, health insurance fún gbogbo ará Èkó. Ìtọ́wọ́ ṣìkìní, ego ṣìkìní, you can register fún ILERA EKO. ILERA EKO, a kò yọ ẹnìkankan sílẹ̀, ìgbéga ìpínlẹ̀ Èkó, àjùmọ̀ṣe gbogbo wa ni.
Lagos Traffic Radio 96.1 FM. Yes, and it's ILERA EKO Extra right here on the station. Happy New Year, first of all. Yes, indeed, it's a new year, 2024. Yes, that year that we have been talking about. Yes, we are finally there. It's so great to be alive at a time like this. Cheers to new beginnings, blank pages, and endless possibilities. Welcome to a year filled with grace, growth, and glorious adventures. Welcome, welcome, welcome. It's 2024, and yes, I'll just say, what is that thing you set out to do? What is that thing you want to achieve? Yes, it's a good time to start. Yes, you should have started yesterday, indeed. Get to it, get to it, get to it. We're already in the first day of the new year. Okay, so with that said, I want to say it's so great to be here. Welcome to ILERA EKO Extra, your favorite show on the radio. Yes, where, of course, we bring you ways and means to get to access pocket-friendly, affordable social health insurance plans. Of course, no age limit, no operational waiting period, and, at little cost just for you and your family. Yes, I'm talking about ILERA EKO. Yes, my name is Akan Usen. Yes, we don't have any guest today, but of course, I trust that it will be the same goodness, the same bumper package of information to help you access healthcare at little or no cost. Yes, of course, this program is brought to your listening pleasure, courtesy the Lagos State Health Management Agency, yes, LASHMA. And of course, ILERA EKO, Lagos State Health Scheme, LSHS, is a health insurance initiative of the Lagos State government targeted at achieving universal health coverage for a teeming population of Lagos State residents. It is backed by law, and it seeks to bring to Lagosians affordable healthcare at very little cost. Okay, you can access to over 531 hospitals in Lagos. So if you live in Lagos, if you work in Lagos, this is for you. Okay. So of course, as the show progresses, I will be going into and giving you a bit more information on the goodness of ILERA EKO. Trust that even as the show progresses, I would love to hear from you. Yes, 080-991-20777 and 091-538-77127. Yes, I'd love to hear from you if you're already on the scheme and you'd love to share your testimony, or perhaps you'd just like to ask a few questions. I would definitely love to hear from you. You could also send in your message via WhatsApp 080-991-20777. Of course, as the show progresses, we'll definitely bring you traffic updates, yes, to help you navigate that if you're out and about town. Of course, while the news was going on, we had this update as regards the earlier reported burning mining tanker on top of Oshodi Imod's Anthony, where of course the firefighters were on ground doing the needful, putting out the fire. I can tell you that is now off the road. It has been moved off the road. So if you intend applying that route, you have nothing to worry about. Most parts of town looking really friendly at this time. I can tell you around the Bagada end, really, really scanty vehicular movement at this time around the Maryland inwards New Garage via the Odoyalaro Bridge, looking really good. The Corona Loop looking very, very good. The Anthony Bypass, yes, looking very, very good. Inwards the K2 end, to and fro, looking very, very friendly at this time. That's the latest. Of course, I will come back to our live camera feeds to see if we can, get one or two feeds to, keep you informed of the traffic situation. But straight away, we're talking ILERA EKO, and of course, I've been able to give you a background, let you know what this is all about. So there are quite a few plans. Yes, of course, the ILERA EKO has been structured into plans to suit you and, of course, your loved ones. So we have the standard plan, which of course is the basic plan. The standard plan basically is, let's see, if we can pull that up real quick. So basically, like I said, it's yes, it's the basic, the primary, yes, some secondary benefits, and let's see. So it's the general benefits. You have peace of mind, of course, you know that. It's affordable. You have access to quality care services within the ILERA EKO partner hospital network. You're protected from financial hardships of huge medical bills, okay? Nobody plans for sickness, but if by chance anything happens, there is a safety net, yes, and you have value for money spent. And like I mentioned earlier, no age limit. You have no waiting period, and it's the premium payment is quite flexible, and the maximum age of dependence below 23 years. So anything above 23 years, that's when you're termed an adult. So for the standard plan, registration, you're covered. General consultation is covered. You have treatments, specialist consultation, general surgery, pediatrician. You have access to the gynecologist, physician, orthopedics, that's for fractures and all that. The common ailments, outpatient care for common ailments like malaria, diarrhea, acute respiratory tract infection, uncomplicated pneumonia, simple anemia, that's the one not requiring blood transfusion, simple skin diseases, and other uncomplicated bacterial, fungal, parasitic, and viral infections and illnesses. You also you're covered for follow-up treatment of chronic illnesses, e.g. hypertension, diabetes, sickle cell, asthma. You're also covered for first aid for dog bites, snake bites, scorpion stings, arthritis, and other minor musculoskeletal diseases, all on the standard plan. Children are not left out. Feeding problems, nutritional counseling, treatment of common childhood illnesses, whatever you can think of, the common ones. Also common skin diseases for children. Eye care, yes, treatment of minor eye ailments, including conjunctivitis, parasitic and allergic ailments, simple contusions, abrasions, and all that. Now, for the for the basic for this plan, standard plan, you are covered for lenses and frames up to about 5,000 naira. Okay, so anything above 5,000 naira, you cannot. You have to pay out of pocket. So for me, I feel it's a good one. You also have access to family planning services, whatever you can think of, child welfare services, nutritional advice, health education, and all whatnot. Hospital care and admission. You have access to a standard general ward, single meal where available, and of course you can be admitted for up to 15 days cumulative per annum. Okay, provision of prescribed drugs, you're covered. Blood transfusion up to 2 pints, limit per year. Chronic diseases, screening and diagnosis of diabetes, hypertension, asthma, treatment of diabetes, hypertension, asthma, like I mentioned. Okay, tuberculosis, hematology, and blood tests. All that you can think of, you are covered. Okay, x-rays, ultrasounds. Now for the mother and child, yes, maternal and newborn care, you are covered. Yes, I would love to go into all this, antenatal, cervical, normal delivery, cesarean section, even ear circumcision of the child. That's the male, of course. Ear piercing. A lot of all these things are covered. So much I'd love to go into, but I will definitely. I'm just trying to touch on the things, just to let you know that there's so much you can enjoy. Just coming onto this scheme. Okay, so for cancer treatment, you can access up to a million naira limit on your second continuous year of being on the policy. Treatment of early stages 1 to 2 of breast, prostate, colorectal, cervix, childhood cancer, Burkitt's lymphoma, and retinoblastoma. These and many more. Okay, so you'll be wondering, with all this, how much do I get to pay? Yes, for the individual plan, ILERA EKO standard plan, individual, you only get to pay 8,500. Yes, 8,500. But of course, if you're paying for your family, yes, which of course, father, mother, and maximum of 4 other dependents under the age of 23, it is 40,000 naira for the standard plan family. Individual is 8,500. Now we move on to the ILERA EKO Standard Plus plan. Okay, Standard Plus plan is just has it's the standard plan then plus some add-ons. Now I mentioned quite a few things for the standard plan, but just to add to this, I will not run through all that you get to enjoy. But let's just see. Okay, so I know. Okay, I mentioned physiotherapy, a few other things for the lens and frames. Okay, for the standard plan, I mentioned that you could only access up to 5,000 naira limit, but for the standard plus, it's 10,000 naira. Anything above, of course, you pay out of pocket. Let's see, for cancer treatment, for the other, it was for the standard plan, I mentioned that it was a million naira, but for the standard plus, you have access to a limit of 2 million naira for cancer treatment from the second continuous year on the scheme at designated centers, meaning you must have been on the scheme for at least 2 years. Now you would say, how much is this? Yes, for the standard plus plan, for the individual, is 15,000 naira per year, but for the family, standard family, for standard plus plan family, it's 70,000 naira per year. We'll move on to the seniors plan. Of course, this is a customized plan for the elderly. That's 60 years and above, 60 years and above. So what do you get to enjoy on the seniors plan? Of course, like I said, it is customized for our grandpa, grandmas, the seniors, 60 years and above. What are the benefits for the seniors? Of course, healthy seniors. You have access to robust medical benefits, screening, bespoke screening and facilities. Of course, the premium, you agree with me that it's affordable, peace of mind, budgetable medical expenditure, and also greater value for money spent. Let's see a few of what of course, you can access. Of course, general consultation. You have specialist care. Yes, of course. General surgeons, gynecologists, and all the things you get to enjoy for the other two plans I spoke about. But let's just see. Being an elderly person, there are some things that they are peculiar with elderly people, which I'm just going to point out, which of course has to do with tests. There's some tests you need to go do. Yes, when you are on this plan, you actually can access all those tests yearly, and you get to get treatment and whatever you have to do. For the individual premium for the seniors plan, it's 34,000 naira. For the couples, it is 65,000 naira. You will agree with me that this is quite affordable. Yes. Okay. So if you have any questions or you want clarification as regards any of the plans I spoke about, feel free to connect with me at 080-991-20777, 091-538-77127. If you're already on the scheme and you'd like to buttress any of the things I spoke about, feel free to connect with me. A quick breather and I'll be right back. Stay close.
Mommy, Shade, this child looks sickly. Try and take her to the hospital. I wish I could, but expenses are too much. Don't tell me you have not heard about LSHS ILERA EKO. ILERA EKO? What is that?
Lagos Health is our wealth. ILERA EKO.
Oh yes! Lagos State Health Management Agency, LASHMA, has designed an affordable and quality healthcare scheme for Lagos residents. In ILERA EKO, at your convenience, you can have access to antenatal, delivery, immunization, management of hypertension, diabetes and other illnesses, family planning and basic emergencies. Register with ILERA EKO branded agents and at the nearest ILERA EKO branded outlets. Pay 40,000 naira annual subscription for a family package or 8,500 naira for an individual package and start to experience peace of mind. For more information, call 0700 ILERA EKO or 0800 Ask Lashma or visit www.lashma.com. ILERA EKO, affordable and quality healthcare for Lagos residents.
Lagos Health is our wealth.
Lagos Traffic Radio 96.1 FM, and it's ILERA EKO Extra. All right, a quick look at the roads. Inbound and outbound on the Lagos-Ibadan Expressway is looking very, very good. So free. The length and breadth of Ojodubaja is looking good. No record of any impediment. And of course, we have traffic managers on ground, making sure everything moves smoothly. Okay, I seem to have a call. Let's see if we can take this at this time. Hello, good morning.
Good morning.
Yes, Happy New Year.
Same to you, compliment of the season.
Yes, indeed. Who am I on to?
This is Yusuf. I'm calling from Alakuko, Lagos State.
Yusuf, okay, from Alakuko. Great to have you on the show. Okay, please go on.
Yes, I'm a subscriber on the ILERA scheme.
Which of the plans?
That is individual standard plan.
Okay, great. Okay.
But my reservation about the activation period time.
Okay.
Is that I am aware of the way
Yes.
The activation period should not be so long for somebody who is undergoing maybe serious health challenge and need to see doctor.
Okay.
After payment, I think the person should be able to access that any facility or to make consultation. Maybe at least a week is okay. But for a month, it's too long. So I think the people are in charge of the scheme. They should do something about the activation period.
Okay.
So that's my observation because I'm on it and I was told that I will need to wait a month.
Okay, so I'm thinking. Okay, this is maybe probably when you registered, you had passed the cutoff date. That's why you had to wait for an extra month. Is that what you're talking about?
Yes, I registered on the 26th.
Okay,
so I was asked to wait.
Yes.
Till the 1st of February. Yes.
Okay, and did they explain to you why that was so?
They said they have to
compile.
Compile.
Yes.
Till another hand.
Okay.
And I think for somebody who needs
immediate attention, yes, I understand you perfectly.
I'm not talking of myself, I'm talking of other
people. Great. I understand you perfectly. Okay, so this is noted, and I'm sure the officials are listening, but also I'll do you a solid. I will convey this, and I'll send your number down. Any question and concern, of course, they will reach out to you. Is that fine?
I just want to which the PS, I think your
yes, the PS.
So I won a gift.
Oh, okay.
From ILERA EKO.
On the station?
No. There was this one organized at Old Secretariat.
Oh, okay. Okay, so you were one of the winners.
Yes, I won a gas cylinder.
Great.
So I want to thank them for that. This thing.
Okay, so spread the gospel.
So I'm doing so.
Thank you very much.
I'm on all platforms.
Thank you very much, Yusuf.
Social media. Yeah, welcome.
Do have an amazing year. Thank you.
Thank you. Yeah.
Yes. Okay. Thank you, Yusuf. All right, straight away, I'll just see how I can touch on the rest of the plans. We have another plan tailored for sportsmen and women. So if you're a sportsman, if you're an athlete, if you have a very active lifestyle, this is for you. It's tailored for sportsmen and women active in sports, and it's about 60,000 naira per annum. We have the one for children, students in school, secondary school, primary schools, which is called the ILERA EKO school plan. It's 7,500 naira per annum, and of course it's for children in school. Just running through a few of this. Yes, let's see if we can touch on. We also have the ILERA EKO tertiary institution plan, which is 5,000 naira per annum. It's designed for full and part-time higher institution students. So you might not be a full-time student, you might be a part-time higher institution student, as far as you can prove that it covers you during session and out of session. We have the EKO Telemed plan, which of course is a tele-consultation plan designed for residents to have access to remote medical consultation from the convenience of their homes and offices. Okay, and that is just 3,000 naira per annum. And let me round up with the diaspora plan. Of course, it provides a window of opportunity to Nigerians living abroad, and of course, you just want to provide health insurance coverage for your loved ones resident in Lagos State, and that is it's $55 or £45 for the individual, whereas for the family plan it's $270 or £220 for the family plan, and with that your family, your loved one is covered. I'll quickly run through a few of the let's see if we can touch on because I see Yusuf brought up a question. A few people might have a few reservations and a few things, they say, okay, so if you want to come up or register, be a part of this, you can register through one of the Lagos State Health Management Agency designated enrollment points, or any of the platforms. Okay, choose a hospital of your choice. That's the progression from the list of accredited hospitals in the scheme. You can make a payment directly to LASHMA through the channels. Okay, they will put you through all this. Let's just leave that. Okay, if people want to know, how do they get to know the accredited hospitals? Well, when you're registering, there's a list of accredited hospitals which will be made readily available, shown to you, and then you will choose. Now, the question is, when and how can you access care? Well, after registration and payment, you will have to wait for a period of not more what Yusuf was saying. If you pay beyond the cutoff date for each month, you would have to wait for 30 days. Okay, so of course, I'm sure something will be done about this because of those who perhaps might have one emergency or the other. So I'll quickly go to how, if you need more information, how to reach out to officials of Lashma to get more information. So you could place a call across to 0700 ILERA EKO. That's 0700 ILERA EKO. That's 0700 4537 2356. I'll take it again. 0700 4537 2356. You also have another number you can call, 0800. That's 0800 Ask Lashma. 0800 Ask Lashma. That's 0800 0800, okay, 27552, then 7462. You can also just visit the head office, Lagos State Health Management Agency, number 17 to 19, Cafe Street, Alausa, Ikeja, Lagos. And, let's see. A few of the divisional offices. Let's see if we can quickly run through those. We have the Ekpe Divisional Office opposite Legali Ayorinde High Court in Ekpe. You can reach out to Mr. Afis Lawal on 081 672 36479. The Ikeja Divisional Office premises, Igondo Ikotun LCDA Secretariat Ikotun. You can reach out to Mrs. Jennifer Stevenson on 080 33 4726. Ikorodu Divisional Office, it's at the premises of the General Hospital Ikorodu on TOS Benton Road, Ikorodu. And you can reach out to Mr. Adeolu Adedeji on 070 3506 7119. Badagry Divisional Office, you can reach, it's at the premises of General Hospital Badagry, and you can connect with Mr. Ebenezer Toyon on 080 281 63072. For the Lagos Island Divisional Office, the premises of the Etiosa East PHC. That's at Akin's bus stop, Aja. And you can reach out to Mr. Olamide Mustafa on 081 016 58996. Well, it's been a great time on the show, and I'm sure, of course, next week we'll have a guest on the show to throw and shed light on more topics as regards the goodness of ILERA EKO. I would advise in this new year, think of your family's health, and of course, because no one plans for anything bad, but it will be nice to have an assurance and peace of mind in knowing that, come what may, any eventuality is covered. Get yourself an ILERA EKO plan in the new year. Happy New Year to you. My name is Akan Usen. Big thanks to Victor Oteri, and a big thank you to Bimbadi of the PAO Lashma and of course we're going to be coming here next week with a guest. Yes, I'm very sure of that. And so same time, same station. It's ILERA EKO Extra. Get yourself an ILERA EKO plan. Bye for now.
Let us work hand in hand. Lagos health is our wealth.
Awashala legoa, awala lemiwa, kadba so fun taiba. Eko ni bajo, ìlera tó tó, ìwòsàn tó dára, àlàáfíà tó yege. Eko ni bajo, ìlera ìlera tó tó ìwòsàn tó dára àlàáfíà tó yege èkó oníbàjẹ́ o.
ìlera èkó ìlera èkó health insurance fún gbogbo ará èkó.